so we'll talk about it maybe later. But it went very well. We're here today to announce a historic victory for American women, mothers, and families with the actions I will outline this after slash the cost of IVF and the treatment and many of the most common fertility drugs for countless millions of Americans. Prices are going way down, way, way down. I want to thank Libby Horn, who is the Senior Vice President of Fertility of EMD Serrano. So I want to thank you. Let's see here. That's what I thought. I thought it was you. Thank you, Libby, very much. And let me also thank the Secretary of Health and Human Services, Robert F. Kennedy, Jr., whose wife destroyed the people on The View yesterday. I have to say that. I'm not going to ever get into an argument with her. And you've decided, you learned that a long time ago, right? She did a great job, actually. Secretary of Commerce Howard Lutnick, thank you, Howard. Secretary of Labor Lori Chavez de Rima, thanks, Lori. Howard, thanks. CMS Administrator Dr. Mehmet Oz, who's a fantastic guy, and he's done really well. FDA Commissioner Marty McCary, thank you, Marty. Senator Katie Britt, who got me started with this whole thing when she called up to say there was a bad ruling by a judge, right? We got to do something, sir, and we did it very quickly. Probably in 24 hours it was done. Congressman Richard Hudson, a great guy, and his wife Renee. Richard, hi, Richard. And Advocate Samantha Bush, who's a very respected person. For years, American couples struggling with infertility have faced crushing costs in their quest to start a family, and IVF is among the most expensive treatments of all. A single round of IVF in the United States can cost up to $25,000, can actually go a lot higher than that, and many couples require multiple rounds for a successful pregnancy. A major reason for these high prices is the excessive cost of the drugs involved. The number one fertility drug used in IVF is currently 700% more expensive in the United States than the rest of the world. And, you know, we're ending all of that. It's called favored nations, and we're ending it pretty fast. Nobody thought we'd be able to do it, and we've done it. Drugs are going to come down. Drug prices are coming down 400%, 200%, 600%, numbers that nobody's ever seen before. Great for Medicare, Medicaid, even Social Security. Great for everything, I think, Dr. Oz. So it's something that's, to me, it's very exciting. I'm bugging him and Bobby all the time. How are we doing with that? And we're doing really good, Bobby. Right? It's really going good. Other countries are agreeing to it because if they don't, we put tariffs on them, and then they agree. So it's amazing. It's amazing how that worked out. But as an example, in London, you'd buy a certain drug for $130, and even less than that, I guess, $88 as of a count a month ago. And in New York, you pay $1,300 for the same thing. So now we're going to be paying, instead of $1,300, you'll be paying about $150. And they'll be paying $150 too. We're going to pay the same thing. Favored nations. It's beautiful. It's a beautiful thing. And we've been ripped off by the whole world for a long period of time. One of the most popular fertility drug regimens costs over $5,000 per cycle, as an example. Wow. Largely as a result of these unsustainable prices, 70% of the employers do not offer insurance that covers IVF. Therefore, most couples with fertility challenges are paying these costs entirely out of their own pockets, which is not really possible to do. Oh, look who we have. Look at that, the great Maria Bartiromo. I didn't know. Did you get put into the regular pool pack? That's very good. Yeah, that's good. Nice to see you. I'm doing an interview with her in a little while. In the Trump administration, we want to make it easier for all couples to have babies, raise children, and start the families they've always dreamed about. That's why today I'm pleased to announce that after extensive negotiations, EMD Serrano, the largest fertility drug manufacturer in the world, has agreed to provide massive discounts to all fertility drugs they sell in the United States, including the most popular drug of all, the IVF drug, Gonal-F. So it's Gonal-F. Is that a proper pronunciation?
Very
Close
well
enough,
done.
right?
Very well done.
Gonal-F. As part of this agreement, EMD Serrano will list their fertility drugs online at trumprx.gov at very, very heavily reduced prices, prices that you won't even believe. And ultimately, that's because of the favored nations. In addition, the FDA will be working with the company to expedite review and approval of another common fertility IVF drug, and currently it's selling in Europe. It's Pergoveris. And that's a sound nice name. Pergoveris. Why can't you name them nice, simple names? Nice, easy names. Doesn't matter. If it works, that's all we care about, right? Upon approval, this drug would directly compete against a much more expensive option that currently has a monopoly in the American market, and this will bring down costs very significantly. And the other one's going to have to come down also. Finally, EMD Serrano has agreed that all future drugs and everything that it develops and sells in the United States will be offset at most favored nation prices. I've been after this for a long time. And we started the process in the last administration, and then we had a little thing called COVID that came up. We had to focus on that, did a good job on that, too. And they'll bring a significant portion of their drug manufacturing back to the United States. So they're going to bring it largely back into the United States, and that's for a lot of reasons, but primarily because of the election result, November 5th, and maybe most importantly because of the tariffs, because if they do it here, there are no tariffs. So we're going to be very close. I think by the end of this year, we're going to be very close to $20 trillion in investment. As an example, the Biden administration had less than $1 trillion, substantially less than $1 trillion for 4 years, Maria. Can you imagine? 4 years, less than one. We're going to break $20 trillion of investment, and we're already over $17 trillion. And that's in 8 months. Can you believe that? And he was at less than $1 trillion. And in addition to that, he had open borders, allowing millions of people to pour in. What an administration that was. Worst president in history, by far. As a result of these actions, the per-cycle cost of drugs used in IVF will fall by an estimated 73% for American consumers, and the numbers are going to actually be very substantially higher as time goes by when it really kicks in. For most of, I mean, think of those numbers. You know, I told the story last time because we were with Pfizer, and Pfizer's doing something very similar. But I told them that my first term, I was so proud of myself because I was the first president in 28 years where drug prices went down for the year. And you know what they went down? 1/8 of 1%. But I was so 1/8 of 1%. Now I'm getting them down, Maria, 500, 600, 800%. In some cases, even more than that. It's hard to believe. But I was proud. I said, oh, wow, I'm the first one. 1/8 of 1%. And I was proud of that. Now I realized, and I called a news conference. Some of you were at that news conference, actually. And I said, ladies and gentlemen, congratulations. We've gone down by 1/8 of 1%. And now we're going down 500, 600, 700, 800%, Richard. So it's really something. For most administrations and all of the people involved in this kind of thing, this action would be a crowning achievement of their agenda for fertility health. But for us, it's really just the beginning. It's just the start. It's one of many things we're doing. Today, we're also taking historic steps to vastly expand access to insurance coverage for fertility care, including IVF, something that, as you know, was not covered. Effective immediately, for the first time ever, we will make it legal for companies to offer supplemental insurance plans specifically for fertility. That's never been done before. We're signing it in today with what we sign. Americans will be able to opt in to specialized coverage just as they get vision and dental insurance. They're going to get fertility insurance for the first time. So I don't know. I don't know how well these things are covered. I see the Democrats like to take credit for all of the things we do. We do the things and they take the credit. But I figure if you do enough of these, eventually people are going to figure it out. The Democrats have done nothing. This will make all fertility care, including IVF, far more affordable and accessible. And by providing coverage at every step of the way, it will reduce the number of people who ultimately need to resort to IVF because couples will be able to identify and address problems early. The result will be healthier pregnancies, healthier babies, and many more beautiful American children. It's a big factor. It's a big deal. I'm asking all employers to make these new fertility benefit options available to their employees immediately. The initiatives I've just announced are the boldest and most significant actions ever taken by any president to bring the miracle of life into more American homes. And I will say Katie was great. As you know, she's a great senator from Alabama. She's the first one that told me about this. I had not known too much about it, and we worked very rapidly together, didn't we, though?
Mr. President, you saved
we had
the day.
everything passed, and Alabama then took care of it and passed it. Within a week, everything was done. Really, it was something. So I want to thank Katie, Brett. There's no deeper happiness and joy of raising children, and now millions of Americans struggling with infertility will have a new chance to share the greatest experience of them all. So I'd like to thank all of the people that are here, and I think we'll start with Dr. Oz and Ms. Horn. We'll go through the list and we'll listen. And yesterday I did this, and I stood for about an hour and a half as people spoke. And I said, this time I'm sitting right there, and I'm going to watch you. I stood for an hour and a half like this. I said, you got to be kidding. Here we go. It was one after another, and it was wonderful listening to them. But I said, if I have to do this every day, Bobby, should I stand or sit? Thank you, Bobby. Please, Dr. Oz.
Okay. Mr. President, I'm going to jump in here real quick.